So today we're going to talk about a very common question: how fast do concussion symptoms start? And this is a common question that can get really nuanced and messy and kind of different on a patient-by-patient basis. But for the most part, it's very textbook. Hey, I'm Dr. Mark. I have worked almost exclusively with concussion and post-concussion for the past 5 years. In that 5 years, I've cleared over 500 people: professional athletes, collegiate athletes, high school athletes, non-athletes, grandparents, teachers, entrepreneurs, everyone. So on this channel, we discuss concussion rehab, how to get over your symptoms, and how to get back to work, school, sport, or just your regular life. So we're going to walk you through a textbook concussion: how fast do symptoms start? And I'm going to quote from the 2022 Amsterdam consensus here, so forgive me while I read, but symptoms and signs may present immediately or evolve over minutes or hours and commonly resolve within days, but may be prolonged. So it was the 2022 Amsterdam consensus, and they basically said symptoms are going to start immediately or evolve over minutes or hours. That's kind of that. Another paper in 2021, this was the clinical assessment of concussion and post-concussion for neurologists. They said, quote, "Given the known pathophysiology of concussion, it is considered not possible for symptoms due to concussion to emerge on a timeline longer than about 2 to 3 days after injury." So the punchline here is generally symptoms are going to present immediately, within hours, but no later than 72 hours after your injury. That's it. So what do we mean when we say due to the known pathophysiology of concussion, you're probably not getting new symptoms after 72 hours? We're referencing the seminal work from researchers Giza and Hovda and their description of the neurometabolic cascade of concussion. Now, I did a recent deeper dive into what happens in the brain during concussion. We talked kind of in depth about the neurometabolic cascade, but I'll summarize it again here. In concussion, your brain functionally, not pathologically, stretches and shears, and this allows electrolytes and neurotransmitters to go everywhere. And this phase is called excitotoxicity. Then, because of this excitotoxicity, when we have to clean it all up and start to repair, your brain actually goes into an energy deficit that takes about 30 days to completely normalize. Now, I want to emphasize it's not nothing to reach a concussion threshold. Not every bump, jostle, bang, head bangy boo-boo is going to result in a concussion. Concussions occur at 15 to 32 times the force needed for whiplash. And remember that whiplash and concussion on paper look identical. So if you've reached the linear or rotational acceleration forces sufficient enough to stretch your brain, you're probably feeling that sooner rather than later. We say 2 to 3 days because that's when we see the peak energy deficit. Your brain goes into about a 20% deficit following concussion in the first 3 to 5 days. And so if you're a nerd and you understand neurophysiology, just like an action potential, it's kind of all or nothing. You either have a concussion or you don't. You reach that threshold to shear and kick off that cascade, or you didn't. That neurometabolic cascade happens or it doesn't. I'm getting kind of repetitive here, but that's why we're actually quite confident that you will experience symptoms on impact or shortly after, but not longer than 3 days after the injury. But what if it is 3 days? I mean, I have a lot of these consults and I have a lot of these questions. What if it is 3 days? I have people that are in funky accidents, hit their head on things, and they're like, I felt fine. I felt kind of weird in the moment and the next day, but then it went away, and then 2 weeks later it showed up. There's kind of gray area here for folks. So for that first scenario where like, this is actually really common, where I hit my head, I felt weird for the first day, then it went away, then 2 weeks later everything got worse and I've been downhill since. So maybe you didn't recognize the subtle symptoms of concussion as independent symptoms until you needed to get back to work, to school, or to sport. So the challenge of these normal activities sort of shines a light on the deficits, and that's maybe what happens there. And this is even echoed in that paper of the clinical assessment of concussion and post-concussion for neurologists. They're saying, hey, it's not likely that it's going to show up after 3 days, but maybe it does because these individuals were in circumstances that didn't challenge those systems. And then when they return to normal life, then the symptoms are highlighted because the deficits are highlighted. And again, this is all clinical. This is what I've seen in my practice, not necessarily what is published in all the papers. That last piece was published, but these other pieces I haven't necessarily seen, but this is what I've seen clinically. So when the patients come in, or when we go through the assessments, we go through the symptom screenings, we go through computerized and all the fun stuff that we do, what we'll find is it's usually the neck or mental health. So that's not to be dismissive. Remember that concussion and whiplash look identical on paper. So it's possible that you're dealing with a significant neck issue that's messing with your life, but it wasn't a neurometabolic brain injury. And then we've also got to remember that the role of psychological health in both concussion and orthopedic injury, pre-existing and post, plays a huge role in how you're feeling. And then there's scenario 3, and this is less common, but it's still present, and we're getting more and more research on this. It could be that it's metabolic or hormonal, and it took a while for that to show up. And when I say metabolic, I'm not talking about acute inflammation, because again, you're feeling that acute energy deficit, you're feeling that acute inflammation. We're talking about like hormonal changes. So as an example, we have newer data that followed women after sports-related concussion for for 90 to 120 days just to ask them about their cycle, to ask about the menstrual cycle. And they compared these to women who had orthopedic injuries. So let's say shoulder or elbow or knee or hip versus concussion. And what they found is that women with concussion were 5 times more likely to report menstrual abnormalities in the 90 to 120 days after a concussion. And that's something that would take time. If you were injured and it's, you're 2 weeks from your next cycle, you're not going to notice that cycle abnormality or those extra or different PMS symptoms, or that's something you're not going to notice until it shows up. And so it could be that it's a metabolic issue. The other thing to remember that is really, really, really important, if you follow me on social media, you see a hashtag HealthyOnPurpose, and I talk about being healthy on purpose. To summarize the big picture, a concussion is a neurometabolic injury with a pretty well mapped out cascade of events. And so in mild traumatic brain injury or concussion, symptoms are going to begin immediately within hours to days, but no later than 72 hours, no later than 3 days. If symptoms do appear later than that, you might be a unique case, or more than likely, you're probably dealing with something that's not concussion, not explicitly concussion, and that's okay. We can still manage that. So I appreciate you sticking around. If you learned something or enjoyed this video, you might also learn or enjoy something about these other videos. Until next time, I'm Dr. Mark. Thank you for watching.